Thank you very much, Professor. Thank you to McGill University for this invitation. So with no further ado, I might start by, before I talk about the mental health problems, issues, and challenges, to say that it's a macro somewhat perspective, which is a summary of what we have in terms of knowledge at the Ordre des psychologues in the last few years. So first of all, I'd like to start, for those who don't know it, the mission of an ordre, a professional order, is to look into the services of their members. So if we go through the accessibility of those psychological services, the quality of them, and of course the professional development of the practice and continuous training. So of course, the functions have to take the competencies at the admissions, and as the person evolves, we need to make other further trainings. There's inspections, and when there are issues, there's an investigation and some suits. If it goes that far, when there's a fault committed, and we're also mandated for the practices of our members, namely psychotherapy, which is a reserved activity because it was considered as being at high risk of prejudice since 2012, the evaluation of the mental troubles, which is a diagnosis, and psychological evaluation. So just perhaps to mention, with the psychologist, just to give you an overview, there's 9,291 members. So a lot of us that are located in Quebec, 70% of our members who practice psychotherapy, 57% that evaluate mental disorders, 12% the neuropsychological disorders evaluation. And so there's 30 in the environmental and the work environment, the 37 are in private practice, 20% in private and employers practice, and 20% in the public health and social services network exclusively, 8% in the school environment, and 2% in teaching and research. So that's more or less the overview of the staff. Our sources of information with respect to our issues. Well, first of all, the scientific literature. There's many directions in the order. So one, for the quality of the development and practice. And I'm accompanied today by Mr. William Cote, who's also a scientific advisor in communications. And I take advantage of it, the opportunity to thank him because he assisted me in the preparation of this conference. And he's has a great contribution to our sources of information because not only does he participate to the literature, but with the survey with our members. So all the literature and the surveys, we've developed a platform that allows us to communicate bidirectionally with our members, and we can get a pulse from all over Quebec, although they're more concentrated in the Quebec and Montreal area. So they are in very diversified places. We also have consults and collaborations with various ministries, more specifically health and social services, but also the elderly, family, public safety, justice. Those are also sources of information. Professional inspections, we expect about 5% of our members, so it's 500 psychologists yearly that are inspected, and they are a very important source of information for what's happening out in the field. Code of ethics, so we have a person that answer 8,000 ethical questions, so we have a great deal of concerns by the members. Also, there's informal exchanges, formal and informal exchanges. So the exchanges are quite diversified, although they're not always systematic, like in the research protocol, for instance. So that brings us to talk about the timely realities. At this time in mental health, we can see that the needs are always evolving. The needs of the population are in strong growth. There's an increase of the request for consults. They talk for themselves. We often receive requests from people that come from referrals. And so we have numbers on the number of people that are seeking help. And of course, we also know that there are wait lists to go to the public systems. We know there's some wait lists before the pandemics varied from 6 months to 18 to 24 months for the public health. And this being said, those that have money can go to the private. It's no longer true because the private offices are also quite saturated since the pandemic. So at present, the population is demanding a great deal of services. There are many reasons that are highly hypothetical that can explain this. The first, there's all kinds of organizations who have worked a great deal at educating the population and at reducing the stigma. So of course, 30 years ago, to say that we were going to consult with a psychologist, nobody would say it out loud. Well, now people are talking about freely about it, and that much more to it. It even sounds good to say, well, I'm in some of the environments to say, well, I'm going to visit my psychologist. So there's still a great deal of work to be done about the stigma, but a great deal has been done. So people are better educated. They have a lot of documents, and there's a lot of platforms and media, public people that talk about the mental health troubles. So people are better educated, and they do want to have access to a consultation. And there are activities, so we made sure that those professionals that were doing those activities. So that's that. And now about the contemporary realities, what we do see is the media headings. We can see that there's an increase of the society, the youth, increase in depressions and anxiety. I'm trying to get this there's something popping up on my screen, so I'm trying to get it to disappear. Sorry if I'm distracted. We can see that there's a raise of anxiety, and what's a bit particular, if we go to the next slide, is that there's a strong prevalence, and I'm talking about the mental disorders that we're seeing in the first lines that can affect just about anyone, and that could affect anyways a good number of people in the general population. So there's a prevalence of anxious and depressive symptoms, and we're not talking about serious mental disorders, but we're talking about consulting for anxiety and depression. And what's particular is that normally when you have a health issue, the more you treat it, the more it disappears. Whereas for anxiety and depression, the reality is the more that we treat them, the more there are. And so that raises questions. So we cannot eliminate the prevalence of anxious and depressive prevalence. And if we take the number of medical prescriptions throughout the year, for antidepressants, we have a portion of the reality. What we do not have is what type of depression are we talking about? So all depressions are not equivalent. A first episode in a depression in a person that has all the prognostic factors to their advantage is very different from a third episode on a borderline problem issue as well. And so that is why the mere indicator of pharmacological treatment does not suffice. Another thing that we do not know is that there's a percentage that has access to psychotherapy, because the reports from the reports in excellence in health and mental health said clearly that for depression, we need to have pharmacotherapy with psychotherapy. Same thing for anxiety. But what we don't know is what is the proportion of the population that has received some meds that do have access to psychotherapy. And the other thing that something else that's been shown is that psychotherapy costs less than pharmacology, and it has more sustainable effects. And it's normal that it be like this for us, because when you work in psychotherapy, of course, the work targets modifying what organizes and regulates the person. So we get work on the regulation of their emotion, on the interpersonal system, and the cognitive system. So we work on elements that will be sustainable in long term. And so in the pandemic context that we've had between 2020 and 2022, although we're not yet out of it completely, but I think for the most part, it's behind us and we're living with it, there's been an aggravation of the mental health issues increase quite importantly, but it doesn't mean that everybody's sick, but it means that we've had an increase of the psychological distress. It's not necessarily the reaction that was abnormal, but it was the situation that wasn't. So many people became extremely anxious, and they had good reasons for being anxious because the situation went outside your control, people's control, and you had to adapt very quickly to things that were quite difficult to predict. So we conducted surveys with our members, and we looked at the literature on the impact of the pandemics on the mental health. And both sources of information were quite well aligned, meaning that what we were observing, what our members were saying, as much in the public health system, or if there was an aggravation of the symptoms, more drugs and alcohol consumption, and troubles in concentration, an increase of the request for consults, and add urgent ones for anxiety and depressive symptoms, family, parental, different. And we can understand that some people don't, what some people went through. So if we look at the comparison, we had good reason to think that the requests for consults privately were down, but we looked at 2023 because we've just asked our members. There's still 52% of the people, the members, psychologists that are still reporting an increase, a considerable increase in the requests for consults compared to last year. So I've always said that the impact of the pandemic on health we're going to last longer than the pandemic itself. So when we look at the American Psychological Association says, in the look of the anxiety disorders, depressive disorders, trauma and stressor-related disorders, sleep, obsessive compulsive, and others, there's no reduction, quite the opposite. There's no reduction between 2020 and 2022, or sometimes it's just to maintain or increased. So that's the North American trend. If we looked at the possible reflections, the factors that can contribute to explain why there is an increase in consults, that necessity to handle or take care of your mental health. Well, first of all, there was a pandemic, but you have to recall that during the pandemic, the wait lists at the public end were extremely long. And we were talking about, depending on the regions and services, we're talking from 6 to 18 and 24 months. And where there's a difference is some people that could had the means. Well, there was an inequity in the services because it's a wonder that in 2023 that access to the health services that have been shown as being efficient depending on your wallet. So I think that we have to level out our mental health needs. At the pandemic, there was international tension. There was the Ukraine war, and at a very small scale and not significantly, I recall that in my surroundings around me at the end of the pandemic, when the war started, people were extremely stressed. And my interpretation is that we had not really gotten over the pandemic psychological, and this starting, that the war started. And so a lot of people were saying, well, some people were talking about the Third World War, possibly in Quebec. And so that wasn't anchored. But this being said, it was as if there was a succession of negative events, and the brain, in cases of negative marked events compared to the positive ones, we know to what degree it's quite absent. So another phenomenon that is quite preoccupant, concern, is the solitude and the isolation. In our offices, solitude is a factor which is important. And so I think, in my opinion, it brings people to consult as well, because even if we have a great deal of knowledge and relationships and Facebook friends on social media, etc., or visibility, when you go through a life crisis, you're hospitalized for something, for instance, you lose your job, people who are having trouble, a seriously ill child, for a parent, we need to help them out. And people don't necessarily have a network or a community tissue or to get help around them. And that also generates some distress and anxiety.
It's not always obvious to find a true support and to be able to find people on which you can depend. Without, in a kind of a free way, without feeling bad. So this was damaged, the social fabric was damaged, and even inside the families, people have more loneliness. Now, the image of social media, we talk about this a lot, but often it gives us an idealized point of view of how people are living, and a point of view that compared to what we live, if we look at, for example, what goes on, how people are happy and beautiful on the social media, we might have the impression that we're not as good as them, but it doesn't correspond to reality. But still, it gives us a perspective, an image, which can lead to cognitive problems. Also, the search for meaning. Climate changes, for example, they also have psychological impact. 20 years ago, we didn't talk about this, but now we've clearly identified anxiety as being a new problem for psychological health. So the object of anxiety is very environmental. Nevertheless, it's very present. Also, uncertainty. We know the tolerance for uncertainty is part of the fundamental elements of resilience. But I think we have more uncertainty than before. For example, with the speed and the diversity of adaptations that need to be done in a lifetime, apart from the events that we've been through in the past few years, it's no longer possible to just go through your life by thinking that you'll finish your life with the spouse that you started your adult life with. Well, it happens sometimes, but in life, we change spouses or family configuration far more often than before. There's a lot more diversity and possibilities. The changes, obviously, which have already always existed, the fact that children grow up and they leave home and you have to prepare for retirement. We live through these transitions, but some life transitions are more frequent and more difficult than before. We don't necessarily end the career in the company where you started your career. So this period of time is over, it's finished. You don't live in a single house. You often change houses, or you live in several apartments in your lifetime. So there's a lot of adaptation that is required. now compared to before. Also, diversity of values. So once again, we are in a society where there's a lot of pluralism. So this creates certain social tensions. It creates problems because we need to live together, and the goodwill we must have for each other. It's very difficult to live while respecting each other when there are elements that we do not understand or that we do not know. So mutual understanding, the point of view about other people, there's a lot more diversity in society. Also, there are more raw emotions. I observe that we live in a society where sometimes I have the impression that there's a lot of a lack of nuances and more sectarian thought, more radical thought. It was particularly true during the pandemic. And for me, the evolution of the pandemic was an extraordinary opportunity to make observations. At the beginning of the pandemic, you have to remember that everybody was planting flowers, everybody was making bread, everybody was shaking hands. We were applauding our politicians and seeing that everything was going to go well. And this discourse fell apart over time because we did not all live the pandemic in the same way. We did not keep the same understanding, the same perception of the situation. And especially, we did not all live the pandemic in the same context and with the same difficulties and with the same access to information. So we've seen ruptures. Ruptures of friendship, ruptures inside families, and so on. So radical thought. And I always say, I have a tendency to remember that when the psychic system is tired, when people are mentally tired because they have chronic stress, and this is what occurred during the pandemic, a chronic stress in which you have to adapt yourself and so on, this sometimes temporarily breaks down executive functions, including the capacity to judge, the capacity to take a step back, the capacity to think analytically in a critical way with nuances, and even the capacity to have empathy and goodwill towards others. Also, the erosion of desire, which is a phenomenon which is important for me. We are in a society of production, a society where we want to obtain things quickly, in a society where you have to have a performance. So we forget that there's pleasure to desire things, and that sometimes the pleasure is even greater when you obtain these objects. And finally, the intolerance to mal-être, or I think there's a psychological education to make the distinction between being anxious because of the context in a situation where it's totally normal and adapted to be anxious, or to have depressive thoughts when you go through a bereavement. It's normal to have such emotions, versus to develop an anxious disorder, or for example, for many consecutive weeks, you can have a loss of pleasure, or to be isolated socially, or no longer have any desire to do whatever gave us pleasure before. So I think that we have to make the distinction to give tools to our people, which is a major challenge for me. Mal-être, what mal-être is normal and what must be tolerated. For example, for a person who will have a good balance in life, versus to avoid disregarding somebody who needs help. So this is part of the challenge for me. Now, when we look at the future, what are issues? Well, I think that we need to, when we talk about mental health and how we're going to give people mental health, we have to work on the 4 elements that are there. We have to work on prevention. We need to work on accessibility, the quality of services, and the continuity of services. And now I'll explain myself. For me, these are 4 elements which are essential. Why prevention? Well, to give tools to people to help them develop a healthy mental hygiene. We did it for physical health in the schools. We took out fast food. We included in physical education courses the importance of sleep. We told them about the importance of not taking drugs or eating well. We made them run. We made them exercise. So I think we have to do the same thing for psychological health. Explain what anxiety is, explain what are depressive elements, explain what is normal, when should we consult, where should we go to, what are the tools we can develop to manage stress and anxiety, and issues that are not necessarily a problem causing. And this is part of the elements that we have to do. And we have to remember that when we want to work on prevention for youth, we need reference adults around them to which they can refer themselves, and trust them. Adults that do not prevent them from developing their autonomy, but which can guide them either at home or in the school or in the community. So, in my opinion, there's a critical role of the community environment to help youngsters for this. And when we talk about prevention, it's also true at work. Give conferences on mental health, education for mental health. I think that we should do this in the schools as well as in the work environments. And same thing in the media. And when we talk about prevention, all this leads me to talk about self-care, because for me, autosoin, self-care, it's related to prevention, for mental health. And I think this is part of the elements that we need to deal with. Then we need to deal with accessibility. Accessibility, we're talking a lot about accessibility, especially with the reform of the health network and the Bill 15 of Mr. Dubé, the Minister of Health. So we talk a lot about accessibility to services. Well, I'm very concerned by accessibility to mental health services. But that being said, we must not forget that with accessibility, we must not compromise on the quality of services. So how can we define accessibility and quality of services? How do we measure them? Currently, we have indicators that are exclusively quantitative, i.e. the average duration of treatment, the waiting list, and so on. But we don't necessarily measure qualitatively the well-being of the person, the number of recurrences. Do they have the right services? So for me, this is part of the important issues, because when we talk about, I worked a lot on the public health network. It's very easy to make somebody disappear from the waiting list. You just need to take a request and send them to the office of a professional who also has a waiting list to make them disappear from a list. Or after a first phone call to assess the request, and the service can come months and months later on. But what I want to say is that for me, accessibility, we'll obtain it when we'll be able to give, what we've been talking about for the past 30 years, the right service by the right professional at the right time for the person who needs it. So for me, accessibility and quality go hand in hand. And the quality of services, well, once again, it's important not only to develop a clinical program, but we've developed a culture of measuring in the public network. I think it's important to make sure that we correctly measure the quality of services, and we correctly measure also the evolution of the person who's going through these services, and not just only the duration of the service, or we have to measure the quality. So on the next slide, I wanted to give you a point of view of the evolution of the number of psychologists in the public network and the number of psychologists in the private sector. So blue, public, and private in yellow. And what we can see is that there's an important reduction for the past 10 years of psychologists who work in the public sector, and an important increase of those who work in the private sector. This does not mean that we have less psychologists in Quebec. It's that we have less psychologists in the public sector, which means that we have less universal access. And unfortunately, it's kind of an amputation of part of the service offer. in mental health services if we do not solve the situation. And if we look at the following slide, well, in the schools, it's even more dramatic. You have in blue the number of psychologists who are in schools on a regular basis, and in yellow the number of students that are increasing in a significant way in the schools. So if you want to work on education, if you want to work on cultures, if you want to work on the quick resolution, the quick consultation that can sometimes be done inside the schools, we need to deal with this issue. And obviously we know the elements which mean that there's a migration towards the private sector. Now, is remote practice a solution? We have to understand that the pandemic allowed us to develop telehealth. Before, 30% of the clinicians offered internet consultation with a few studies that showed the effectiveness of this treatment. Now it's 90% of the psychologists who offer remote services. It's appreciated by the clientele, but that being said, this has limits. Because, for example, it solves the problem of the proximity of the psychologist's office. So it's possible to consult the psychologist who, if you live in a region, you can consult the psychologist anywhere in the province. But this does not necessarily increase the availability of psychologists, this telehealth. I say that it can help the single parent family, the mother who cannot move, or the farmer who has to do 2 or 3 hours by car to go to consultation. It's not a universal solution, and it's not a solution for all clients, because we have 90% of the psychologists who offer telepractice services, but it's not a service offer which is exclusively in telepractice. So people have a choice to be in person offices. There's still some people who prefer that, especially at the beginning of the consultation, versus telepractice. We also have to be careful to what we call solutionism, i.e., unfortunately, we have a large tendency to, how could I say, you must never try to adapt a simple solution to a complex problem. So the problem of access and quality of services in mental health is a complex problem. I think we have to look at it with many points of view, and we cannot think that we will deal with the 4 elements that need to be dealt with just with telepractice. We have to look at these elements: prevention, access, quality, and continuity, but we have to deal with them a point of view of public health and even a point of view of the whole system to find a solution. How come there are more and more mental health issues? Perhaps we'll have to ask ourselves questions about the sources of these disabilities. Also, continuity of services. We've had a tendency to adapt in mental health the model of physical health of episodes of care. So an episode of care, i.e., you have a health problem. In the next 48 hours, you treat them, then they leave the hospital. But in mental health, it's more complex than that. And the evolutions are far more variable. And I think we have to connect continuity of services with the needs, because there's a lot of rupture of services. When the person, well, for example, I participated in forums for mental health in the past few years, and I heard patients saying things that were very wise. For example, when will you stop developing service offers that make sense for the decision makers but don't make sense for the patients? And second question that they ask is, when will you stop giving us the final congé and kind of throw us out, the discharge? So I want to make a difference between persistent disorders. And for me, a punctual disorder, it's the equivalent in mental health of, breaking an ankle. You have something, you fix it, and it's finished. For me, a major depressive episode that's unique, it can look at that or it could be compared to that. And if you find the comparison that's not good, it's the best example I was able to find to say that in mental health, there are punctual issues, there are episodes in life which can have an impact on any individual. And for me, that's just one thing. But there are also people who will be stuck with either more serious mental issues or neural development issues. So if we think about a person who has schizophrenia, or somebody who has behavioral trouble, or language disabilities, for example, these people will need certain services when they're very young, different services when they become teenagers, where you develop their social relations, also different services to help them find a job, to help them find a home or a shelter. But for me, there needs to be a continuity of services. It doesn't mean that the intensity of services will not vary, but it means that we have to think that these people, every time they have to reconsult, it's very difficult for them, and it's not necessarily the best people to overcome difficulties to have access. So we need to rethink. We need to have a point of view for mental issues that is just as diversified as, the kind of people who have these mental issues. So I would say mental health, it should be recognized just as much as physical health. We know today up to what point we cannot separate both healths. There's one individual who has one overall health. We know up to what point if you have a problem of chronic health or with chronic pain, this will have an impact on your mental health. And on top of that, you have other mental issues, and the inverse is also true. So there's inter-influence between both sides, the physical and mental. And we absolutely have to, and we've really debated at this point in the parliamentary committee for the reform of the governance, the Mr. Dubé's reform, we have to distinguish mental health services from social services. Social services, which are very important, but well, they sometimes come with mental health services, like, for example, for youth help who have a psychotic disorders, for example, in gerontopsychology, but it doesn't always come together. And physical health services and psychological health services and social services, they all need to be provided. Like, for example, when we look at where the psychologists who give mental health services in the hospitals, we find just as much in cardiology or oncology or rehab as in mental health. So we need to distinguish. We have to stop having this confusion between social services and mental health services. And we would need to, the consideration we have for mental health, be evident in the budgets that we give ourselves. And I think that we still underestimate the impacts of not dealing with it adequately, this mental health. We have a tendency to say that, oh, if it's not bleeding, it doesn't look as urgent. Well, sometimes it's just as urgent or more. So we see it absolutely in the social problem that we observe. So we must not underestimate the impact. Mental health issues is the first cause of hospitalizations for youth, and it's one of the most important causes of absenteeism at work long term. Now, that being said, there are human costs, there are family costs, there are financial costs, there are social costs to not deal with this adequately. And in a broader perspective, I think we have to think outside of the box. And if we want to deal with prevention, accessibility, quality, and continuity, we really have to have a holistic point of view to avoid repeating our past mistakes. I think that it remains essential. And I'll end with this sentence. If we don't deal with mental health, it will deal with us. And I'll end with Edgar Morin's quote, which I really like, and I think it's very applicable to the perspective of mental health. If we sacrifice essential for emergencies, we end up forgetting the emergency of the essential. And I think that the treatment of mental health is part of the emergency of the essential right now. Thank you.